Well, welcome, everybody. Super excited you're all here. Let me ask you guys a question to start our morning together. So, who here thinks that more than 50% of people that you're walking around seeing on an average day will have low back pain at some point in the next year? Everybody? Everybody, okay. Good. You'd be right to say I don't even have to ask the other side of the question because you guys all got it right. So I just want to acknowledge, first and foremost, what a big deal it is that you're sitting in this room today. So most people are fairly content to go through life and suffer with back pain or knee pain or really any sort of health issue and not seek out help and get the help that they need. But not you. You're here this morning, you're learning, you're growing as a human being in your knowledge of how your body works. Teresa's like your fourth seminar. Teresa, you're always here. This is awesome. Appreciate it. And you guys you're learners, which is really cool. So I want to acknowledge that. So and then congratulate you because you're going to learn a lot this morning. This morning you're going to learn. You guys probably know a lot of this already. I hope. Hung out with Eric and I quite a bit. Some of it will be repeat, but it'll be good. So we're going to talk about the 3 biggest things that you need to know to eliminate low back pain and get back to living life pain-free. Does that sound good? Okay, good. So that's what's in it for you. You're going to learn those 3 big things. And I want to start with a story of a patient of ours named Diane. Dr. Eric and I worked with this nice lady. She's a business owner, really busy, had a lot going on. She came to us and she was like, hey, I'm nearing retirement. I can't even walk around the block because my back hurts so bad, and my husband and I have built up this nest egg. We're thinking 2 years from now we're going to be retired and we want to go travel. We want to go to Europe. We want to go to British Columbia. We want to do all these things, and I can't even walk around the stinking block. How the heck am I going to go do all this awesome stuff? And she worked with us for a couple months, and we were able to teach her the 3 things that I'm going to talk to you about today, and a few other things, and get her back to the place where she was walking confidently and pain-free. And oftentimes, one of the biggest things we can give people is helping them to latch onto a goal, something that they're working towards, and then to make that their sole focus as they move forward with their physical therapy. Hi, Mary. Come on in. Buenos días.
Buenos días.
¿Cómo está?
Bien, ¿y usted?
Bien.
Qué bueno.
Mary also speaks English.
Yes, I speak English.
Yes. Welcome. So, everybody kind of knows what Village is, except for maybe a few people. So we exist as Village because of all the problems in the medical world today. People are being told, like, you go to your primary care doctor with something like low back pain, and it's seen as almost normal. I worked at Kaiser for over a year, and I saw so many people with low back pain, and it gets put right at the top of their chart, right next to their other host of medical issues, and it's like, we don't have the resources or the time to really deal with this as an individual problem. It kind of gets lumped in with everything else, and so it's seen as somewhat normal and a part of the aging process. There's actually a misconception that as we age, we're more likely to have low back pain. That's completely not true. People of any age are just as likely to have low back pain as any other. And then one of the big problems with the medical world today is this concept of reductionism. And Dr. Eric and I have started talking about this a lot, but reductionism is basically the thinking that if someone has a problem, you should be able to see on some sort of test a symptom or a manifestation of that problem. You should be able to treat it with some sort of medication or thing, reduce that symptom, and then they get better. So for example, cancer, let's say. I know it's a terrible disease. We're going to use it for this purpose of reductionism. Somebody gets cancer, they're given radiation to treat and kill the cancer cells, and then they're retested again using a PET scan or an MRI to show that the cancer has decreased. It's a pretty straight, like, here's the problem, cancer, here's the treatment, we retest them again. Back pain doesn't quite work like that, right? There's no scan. I mean, you could go get an MRI, you could go get an X-ray, but there's no real scan that would show you David has an 8 out of 10 back pain. He could tell me that, but that doesn't really, in the reductionist medical world, give us much information. And so as a PT working in the medical world before I started here, I would have to, you couldn't really talk about pain to insurance companies because you can't measure it. It's an immeasurable, it's a very subjective thing. Like you could tell me, Mary, I'm at a 7 out of 10, but to an insurance company that doesn't mean anything. And it's because we have a medical society that is reductionist. Does that make sense? Okay, so that's why the pain epidemic, especially low back pain, which is the most prevalent, is so difficult for our medical world to treat. And we don't know, because we are in this reductionist line of thinking, we don't know and understand, okay, how do I treat the underlying root cause of someone's problem and not just the symptoms? So we end up, as the medical world, treating symptoms. What are some things that you guys think would treat symptoms? Pills?
Hot packs.
Hot packs, yeah.
Spinal injections.
Injections. There's one other big one. Medication in general. Surgery sometimes is a symptom treater. So yeah, surgery would be a great example of reductionism. So you see on someone's MRI that they have a bulging disc. One-time snapshot into someone's back, and you could say, okay, we could cut that piece of the disc off, and then the pressure on the nerve is going to go away. It makes a lot of sense in theory. Unfortunately, for a lot of people, it doesn't work out quite like that. My father-in-law is a radiologist, really smart guy, and he would be the first to admit that way too many people are given back MRIs and that the findings from back MRIs don't tightly correlate with people's pain. He's told me that from the moment I met him. I asked him that question. I was like, so I'm learning this thing in physical therapy school, and learning that MRIs don't really match up with pain. He's like, you're absolutely right. And they're not really good at finding pain. They're good at finding tumors and lesions and bowel obstructions and things like that, but not so great with pain. But people are given MRIs when they have really bad back pain. So I digress. Reductionism. So the back pain big three. Excuse my lovely handwriting. It's a back pain big three. So number one is a concept we call explain pain. Which we're going to get into. I'm going to put a 1 there. Number 2. What's number 2? Is ribs and hips. We're going to talk in depth about all of these. And then number 3 is reduce inflammation. Forgive my spelling as well. All right, so let's start at the top. Explain pain. Knowledge of pain and how it works in our body is the single most important and powerful tool that you can have in your arsenal to combat daily chronic low back pain. If you're running around under the impression that your back is hurting solely because of the damage that's in your spine, you're going to be much worse off than someone that understands how pain actually works inside their body. And we're going to dive into that today. So I'm going to give you guys a couple examples of pain that is not correlated with damage. The first one, the simplest one, is one I've kind of touched on already, the MRI thing. So if you take an MRI snapshot of someone's back who, let's say somebody who's died, they never reported any history of back pain, they were in their 80s, they were healthy, they just dropped dead one day. And they take an MRI of this person's back, or they cut open this person's back, and it's filled with degeneration. They've got degenerative disc disease, their joints are compressed, and the doctors are baffled. How did this person not have back pain? And the really simple reason is they were never at such a level of threat or danger that their body needed to alert them to it. And then you have the opposite end of the spectrum, which is I'll see patients' MRI reports who have really bad back pain, and they'll say nothing is wrong. And so the medical world's baffled by that too. How can there not be something that would show up on this person's MRI and let us know what's going on? And that happens in every joint in the body. People with the knee issues will get an MRI, and it'll show up that there's nothing wrong on the MRI. Sorry, here's some painkillers. We can't really help you. Or, maybe you do have pain and there is something on the MRI that shows up and it's like, well, is that really what's causing this? No. Maybe that's structurally something that's sensitizing your body, but not necessarily a cause. And if anybody maybe has heard of the term phantom limb syndrome? So amputees will have pain in a limb after it's been cut off. It's like, well, there's nothing damaged, it's gone, but it still hurts. And then you've got the stories of the soldiers in battle who will literally get shot. There was a story of a soldier who got shot in the butt, didn't realize it for hours. He got back to the camp and they were like, you're bleeding. And he's like, oh my gosh, I was shot. And his body had so down-regulated the pain response and up-regulated his need to survive in the moment there that he didn't experience pain, which is pretty crazy, right? Oh yeah, this is a good one. Sham surgery. Did we talk about this in one of our meetings? There was a study done where these guys in their 60s and 70s were given either a sham knee surgery or a real knee surgery. And the sham ones, they just injected them full of saline in their knee and sent them home, told them, all the same things as the surgical guys. The surgical ones got an actual knee replacement, and then they measured them like 10 years later. They had about the same outcomes. They showed this great video of the sham surgery guys playing basketball. And he was like, I'm so glad I had that knee surgery. And then the doctor who did the sham surgery is kind of laughing, like I didn't get knee surgery. Pretty crazy, right? So I want to convey to you, not that your pain is all in your head, that you're making it up. That's never what I would want someone to think, because pain is very real. And it's a subjective experience that you have, but it's very important that we understand that pain is danger and not damage. Eric kind of hit that point home in our last seminar, but pain is danger and not damage. And when you can explain that to someone else, it empowers you. One of the best ways to understand a subject is to be able to teach it. I learned a ton just kind of like collecting my thoughts as I prepped for this little workshop today. I'm like connecting things in my brain because I have to teach it and explain it to people, and maybe I couldn't have articulated it until I learned it and taught it. So explain pain is one of the keystone habits of people that don't have back pain, and it is the ability to teach someone else about pain. And I would say use analogies when you're explaining, just like the ones I used, and then you can come at it with like the overarching pain is danger and not damage. One of the other really cool analogies that we use is that of the alarm system. So an alarm system in a house, let's say you don't have one at your house. I don't. Somebody comes in when you're not home, they rob your stuff, they take your Le Creuset pans, you're really upset. Even the nice cast iron one, it's your favorite that you cook your eggs in every morning, I'd be devastated. But anyways, they steal all that, so you go home and you decide, you know what, I'm going to have David come over and install a nice home alarm system for me. One with all the bells and whistles. And then you know what? You get robbed again. You get stuff stolen. Now this time they take your favorite comforter from Costco. Hi, Robbie. Come on in. And now you say, hey, David, come on back over. We need to put in some security cameras. We need double alarms. We're really going to amp this thing up. Problem is, David's so good at his job, he makes it so sensitive that when a leaf blows by, the whole alarm system flares up, and goes crazy. And this is kind of what starts to happen in our bodies when we're in a state of chronic pain. Our bodies become so hypersensitive at detecting a threat that even movements like getting up out of a chair can be painful, or walking down the block can be painful, or lifting your grandchild can be painful. Does that make sense? Hypersensitivity is inevitable when we are in pain for a long time, and our body has all these built-in mechanisms to make us sensitive to protect us. So if your back's sensing that it's under threat, and you're getting fed into by the medical world telling you that, hey, you're broken, you have this MRI report that shows that you're damaged, and your friends are telling you that, hey, I had that same MRI and I've had pain for the last 10 years. All those things play a role in making us more sensitive and turning up the alarm system. So we talk about this concept of SIMS and DIMS. So a SIM is what's called safety in me signs. I think that's what maybe it's just SIM. I don't know what the last S is for. And it's an indicator that tells us that our body is safe and secure. And these last two things that we're going to talk about are what I would call SIMS. Having a stable, strong, mobile core, which we're going to dive into next, is a huge, huge safety indicator because it tells our body that it has the security and stability that it needs to be healthy. It doesn't need to be under threat. If you walk out of here today and you don't understand anything else that I talk about other than it's really important to understand that pain is related to our perception of threat more than anything else, that'd be really powerful. If that's all I could give you, that would be great. We're going to give you a lot more though. So DIMS are what are called danger in me. So those are things like a bad MRI report, a doctor telling us that we're going to have pain for the rest of our lives or that we have a bad back. Going to a chiropractor and seeing their x-ray and them telling you your spine is malaligned and you're one step away from being paralyzed or something like that. Those are things that promote that alarm system to become more sensitive. Our body is really smart and interconnected, and our brain is super powerful. That is a powerful, powerful thing, the human brain. And it protects us. It's really good at protecting us. So if it's getting this input from the environment telling us that things are dangerous or threatening, we're going to be a lot more likely to have back pain. So SIMS and DIMS, danger and damage. And then the last one under this category is a concept called graded exposure. Whoops. So let's say you have back pain. Actually, let's go with another analogy. I like analogies. Let's say David was pasty white. I'm using David again as my example. And, he had really fair skin, and he decides, you know what, I'm going to go do some work outside today. I'm not going to wear any sunscreen. I'm going to stay outside all day long. What's going to happen to David's back of his neck right here? Blister. Maybe sunburn first, and then blister. Straight there? Oh boy. Third degree, oh my goodness. Third degree burns. Now let's say David was smart, which he is, and he decides, you know what, I'm only going to go out in the sun for 30 minutes today, and then I'm going to put some sunscreen on. What would happen the next day? Nothing. Yeah, maybe you'd be a little bit more tan. You'd start to develop, I think the pigment's called like melanin. And then what about the next day if you went out for 35 minutes? Nothing. You're a little bit more tan. And the next day 40. And he slowly builds up towards the end of the summer. Now he can go outside all day. And his skin is able to withstand because it has adapted. And our body is much the same way. And what we need to do with painful motions or motions that become painful after a little while is stay under the level of our alarm system going off. So let's say for you, maybe when you lift the yellow kettlebell or you walk all the way around the entire block, things flare up, or you cook for 2 hours for your friends, your back pain really flares up. So for you, it's like, okay, I've got to stay under my level of threat because I want to slowly and incrementally bump up towards the goal that I have. Okay? So let's say it's, I want to walk 30 minutes, or I want to go on a 2-hour hike. Maybe you'd start with 2 or 3 minutes of just gentle walking. And then you'd bump it up to 10 minutes. And then you'd bump up to 12 minutes, and then 15, and you'd slowly ease your way up to that thing that you're working towards. What most people want to do is, oh, I feel good today. I'm going to go walk 2 miles. And it's like, oh my gosh, my back pain flared up again. I'm still broken. And that's the thinking that we get into. And then it's like, okay, now a couple weeks, I'm flared up, I'm inflamed. Now I'm going to wait until it gets better, and then I'm going to do the same thing again, get flared up, and then have the same problem. I had experienced this myself. I was jumping back into doing some strength training after taking some time off to just ride my bike, and I decided, you know what, I'm going to deadlift the exact same weight that I was doing when I was really strong. And I woke up the next morning, I was like, oh my gosh, my back hurts. It wasn't like a muscle sore, it was like my back hurt. And I didn't freak out because I'm, have learned some of this stuff, and I was like, okay, I'm fine. My alarm system's just going off because I did something that was perceived as threatening. And so I just kind of let my back calm down, and then I got sensible and started with a lower weight. Okay, so that's explain pain. Any questions on that one before we move on to the next two? Cool. We'll have time for questions at the end too. So, ribs and hips. The position of our rib cage directly determines the position of our diaphragm, our respiratory diaphragm, which is really, really the centerpiece of the core. And then our pelvic diaphragm, or our pelvic floor, it works in conjunction with the respiratory diaphragm. They have to both work together in order for you to have a strong, stable, functioning core. So Dr. Eric and I talk a lot to our patients about hip position and rib cage position, but really what we care about are the positions of the diaphragms, the respiratory diaphragm and the pelvic diaphragm. They're supposed to work together. When you take an inhale, your respiratory diaphragm, let's do this together. There, put your hands on your rib cage. Take a nice breath in through your nose. What happens to your ribs? They expand. They go forward, up, and rotate out. Now a big exhale. What happens to your ribs now? Yeah, they go down, they go back, they rotate in. And our diaphragm kind of does the opposite. Anybody ever played that game where, I have little kids, so I play this game, where you have the big, like, colorful parachute thing, and you put it up in the air, and then you teach transitional kindergarten, you would have played that game.
Yeah.
That's good. So you slam the thing down on the sides of the parachute, and then the parachute, like, comes up. Yeah, are you sure? The dome thingy. Yeah, that's our diaphragm. When we exhale and our rib cage comes down, it goes up into a nice dome. When we inhale, it's supposed to flatten out. It pulls our lungs down, makes them bigger, gives them more volume, and air comes in. We exhale, diaphragm domes, lungs get smaller, air goes out. This process happens like 25,000 times a day. Crazy. The pelvic diaphragm supports the respiratory diaphragm from the bottom, and when our hips are neutral, which we're going to talk about, it gives you the sense of security and stability to breathe and move like you were made to. And if you get outside of that, dysfunction occurs. Our body has this really bunch of redundant mechanisms to compensate, but all of them have side effects. You might not experience the side effects right away. It could be 10, 20 years down the road, but eventually you will. It'll come in the form of tight upper trap muscles, tight hip flexors, low back pain, digestive issues, all these things. When the homeostasis of our breathing gets off, even just 1 or 2 degrees, bad things happen. So we have a couple tests that we do with our patients where we push on their ribs, we check the position of their hips, and they're external indicators that things are functioning like they're supposed to. Which we're not going to get too into that today, but I want to convey the importance of rib position and hip position. So one thing that you can do to have a mobile and healthy spine is to get your rib cage down and back. That creates a nice tall parachute for your diaphragm. Almost anyone, I'd say 99% of people could benefit from blowing up a balloon. 20 times every week. Blowing up a balloon causes you to forcefully push air into this balloon, and it brings your rib cage down. It activates the deep stabilizing muscles of your trunk that hold your rib cage where it needs to be to stabilize your spine. And if your diaphragm's pulling up into a dome, what do you think's happening to your spine? What? It unloads it. It's like, have you ever been to the chiropractor and they talk about spinal decompression? That's what your diaphragm is made to do. It is a spinal decompressor. And that's why when we have clients that are lifting heavier weights, we tell them to exhale, get their rib cage down, because it unloads their discs and their nerves and all their tissue and creates this strong, stable base for them to lift off of. So you're lifting a heavy piece of equipment off the ground, you exhale, get your rib cage down before you pull it off the ground, and you know you're in the best possible position to do it. Where most people get into trouble is when they go to lift something off the ground and they're in this flared position. Their hips are tilted forward. And I'll have patients come in all the time where they're like, Dr. Matt, I injured my back giving my dad a haircut. And I was like, well, how are you standing? He's like, well, I was like this, extended and arched and reaching. Or I'm extended and then I flex. And trying to flex forward on a flared rib cage is a recipe for disaster. That's where a lot of disc problems happen. Cool. I'm going to use the soda can analogy. So the top of the soda can is kind of like what in this analogy? Diaphragm. Bottom of the soda can, the hips. Yeah, the pelvic floor. Respiratory, diaphragm. And those two things are supposed to move up and down, and they're surrounded by this nice wall of muscle called our core. And when they're lined up appropriately, good things happen. We can take a lot of force. When they're not lined up appropriately, it's almost like there's a hole in one end of the soda can, and you put some pressure on there and fluid's going to leak out. That's a bad thing, right? We don't want our core to be unstable. We want this really solid, stiff base. So you can do all the planks and the crunches and side planks that you want, but until you get your ribs and your hips in the right position to support those two diaphragms, you're building on top of a shoddy foundation. What happens if you build on top of a bad foundation?
The house falls down.
The house falls down. Yeah. That's good. All right, any questions on ribs and hips? Okay, save them for the end. I got it. All right, so number 3, reduce inflammation. If you guys were here for Dr. Eric's chronic pain seminar, he talked for like 30 minutes about the importance of the immune response and inflammation and how